As all we know, post-induction MRD within marrow is currently recognized as poor prognostic among transplant-eligible myeloma patients. An emerging number of studies are evaluating MRD within the context of cytogenetic risk. In the single-center study, which we were presented at IMS 2023 from our Ankara University, we aim to quantify clonal plasma cells by flow in marrow to evaluate the impact on the outcome according to risks determined by cytogenetic risk. In our study, 454 subsequent newly diagnosed myeloma patients who underwent autologous stem cell transplantation were included prospectively. And also our patients' median follow-up after the transplant was 32 months, which was very long. As all we know, deletion 17p, translocation 2020, translocation 414 and 1416, 1420, and 1q gain, and also the complex findings are accepted in our study as high-risk cytogenetics. Cytogenetically, high risk was observed in 19% of our patients, and also post-induction complete response was achieved in 19% of patients. Following mobilization and marrow MRD was undetectable in 14% in our cohort. And having negative marrow MRD estimates a 2 years PFS of 92%. And also it's important to highlight among 4 marrow MRD negative patients, only 6 have relapse. When we divided the patients into 4 groups according to marrow MRD status and cytogenetic risk stratification, Kaplan-Meier curves revealed significant differences in median PFS among marrow MRD negative with standard risk and also marrow MRD negative with high risk compared with the marrow MRD positive population. And also when we have made up a multivariate analysis, it's marrow MRD with a high risk of, with a hazard ratio of 0.26 and post-induction CR with a hazard ratio of 0.19 to determine PFS independent from age, ISS, and cytogenetic risk. So, in conclusion, our real-world triple drug induction-based and majority unmaintained experience among transplant-eligible myeloma patients shows post-induction marrow MRD to be correlated with PFS, and although observed less frequently, achieving post-induction MRD negative marrow may ameliorate the poor prognosis of high risk determined by FISH. Combined analysis of the depth of response and cytogenetic risk appear to increase the significance of risk assessment. Maybe in the future, more intensive induction regimens may allow better recognition of cytogenetic and molecular subgroups versus deep of response in the prediction of long-term outcomes.